When you get there, it's going to be very busy, and the first thing you're probably going to do is sit down and wait. The next thing that happens is you're going to give your basic information. They'll want to see your health card. If you don't have a health card, they're going to want to see some identification, and they're going to ask you questions about who you are, how old you are, where you live, and they're going to get a hospital card for you. After those first questions, you're going to wait again. The next person you're going to see is a nurse, and the nurse is going to ask you about why you're here, tell us about the situation, and they might ask you some of the same questions you already answered at the front desk. After that interview, you're going to wait. And how long you wait depends on whether things are going on in the department at that time, but it might be quite a while. After that wait, you might see a physician who's going to ask you probably some of the same questions that you already answered when you spoke to the nurse. It's important to know that even though you're getting asked those same questions, you have to answer them again. You might feel like, why do I have to say this? I already explained this to someone else, so I'll just skip that part. Don't skip anything. Give the information. Now, how can you make it easier to give the information? If some of that information is already written down on your crisis plan, on your emergency plan, you can say, I've got it all written down right here. Would you like to look at it? We've got a summary right here of what happened at the last visit. Would you like to look at it? We have a list of the medications, an explanation of the diagnoses. Would you like to look at it? But be prepared, in case they don't look at it, to answer all those questions again. Now, sometimes when you're having some kind of emotional crisis, after you see that emergency doctor, that's the end. They're going to think about it, they're going to make some recommendations, and then you're going to go home. Other times what happens is the emergency doctor or physician says, you know what, I think we need a closer look at this from our crisis team or from people in psychiatry. And so then you get triaged, which means you wait to see some of those specialists. And they're going to ask you, when they see you, some of those questions again. And your job is going to be to answer those things as best you can, to remind them about the information that you already have, to show them some of those visual cues, those digital examples of what things are like outside of hospital, all of that. You've got that with you when you have that next interview. Because it's only when you're seen by that last group of people on the crisis team that they can make a decision about whether you should actually come in and stay at the hospital or not. So when you're seeing the nurses and the emergency doctors at the beginning, they're not going to make a decision about admission to hospital. That comes once you've seen the psychiatrist, and it can take a very long time.